Well, there's nothing that I like to talk about more in the Department of Obstetrics and Gynecology at UW. And one, I think it's the most important department in the organization, and I'm shameless in saying that. And two, I think today the important thing is that it represents how UW Health can bring the hammer down when they want to. I'm so excited to be here with you today. Yeah, it's been 6 years. I interviewed for chair on February 14th, 2007. I had never been to Wisconsin. I thought, oh my God, what am I doing? I've been in Boston for 10 years working at Brigham and Women's Hospital and Massachusetts General Hospital. Been at the University of Virginia for 14 years as department vice chair, division chief of Gynecology. But when I came here, I realized, oh my, this is a very powerful organization and a department that's got the building blocks to be the best in the United States. One of my kids, my younger child, said, "Isn't Wisconsin near Oregon?" I thought, oh my God, that's a school for him. So I'm going to walk you through the department, and I want to start with our general OB-GYN division. It is typical for an academic department of obstetrics and gynecology to have a vestigial general OB-GYN group. You know, we're kind of focused on the fancy stuff. Cutting edge, innovation, research. That is not the case here at UW. We have the best general OB-GYN department in the country. Greg Bills in the last 6 years has done a fabulous job. I'm not going to run through the whole group, but I do want to tell you about a couple of his recent recruits. Jackie Ogutha, Washington University. Sarah Bradley, Duke. Kristen Sharp, Michigan. This is a group of people, it's a well-oiled machine. And I am so proud of them because I don't think you can have a Department of Obstetrics and Gynecology without a powerful general OB-GYN group. And I want to make a few points about this. Outpatient issues. It's a large group. Obstetrics and Gynecology is an intimate part of medicine. If you sign up to see one of my doctors for your obstetrics care, you will see that doctor for 9 months. Now, the delivery, it's a large group. No, you're not guaranteed to see the doctor that you've been seeing for 9 months. But having had 2 children myself, you know, the 9-month thing, there's a lot that goes on there. I wanted my doctor there the whole 9 months, and she was there. And in the end, she didn't deliver Olivia and Connor, but I got what I thought I needed, and I was a critical consumer. The other thing we do is that we have multiple sites around Madison. We make it as convenient as we can for our patients. Now, in terms of inpatient issues, 24/7, 365 days a year, one of my doctors is on labor and delivery. There's no driving in when the nurse calls you. No, we're there. We never leave. The place always has one of my doctors present. That's important. The other thing we do is we take advantage of what the University of Wisconsin has to offer in terms of the work that Jonathan's doing and Sally Kraft, the safety and quality issues. We are constantly looking to standardize and improve the care that we give. We are self-critical. Now, everybody knows that the more you operate, the better you are at it. All of the GYN and gynecology at UW-HC is done by our doctors. I operate at UW-HC. I'm a gynecologist. At Meritor, where we deliver our babies and where a lot of our gynecology occurs, there are other groups and doctors that practice there. 81% of the GYN surgery at that hospital is done by my doctors. So if you're going to have a hysterectomy, do you want to have somebody who does it once a month, or do you want to have somebody do that for you that does that every week, every day, lots of surgery? And we are very much on the cutting edge of surgical techniques. We teach members of this community how to use the robot. One of my faculty members has developed a single port surgical approach that's already being published upon. It's an effective surgical group. We review ourselves. Every case that goes to our morbidity and mortality conference is reviewed by a committee of doctors. We review every kind of case that comes our way that's referred either by M&M or the practice committee, and we act upon it. M&M, it's like one of the greatest things in medicine. Once a week we get in a room, we shut the doors, we talk about what's happened, how we can improve things. We are very self-reflective. In terms of community service, we take care of everybody that walks in the door. If they don't have money, we care for them. I'm proud of that. And we train the doctors of the future. I think the most important part of my job is training the doctors of the future. There's a shortage of obstetrician gynecologists in the country, not in Madison, but in the country. It is very important that we turn out quality physicians. This is one of the best residency training programs in the United States. And I want to say that I get many letters from patients saying how much they've enjoyed our trainees. None of these trainees operate or care for patients without 100% supervision. It doesn't happen. That wasn't the case when I was in medical school, which was like many centuries ago. But at this point, it's very clear. Trainees are supervised 100% of the time. And I can tell you from personal experience, if you're training someone, you gotta be smart. Those youngsters can Google everything. And they're asking hard questions, and I'm like at home trying to make sure I know everything. It's a good thing to be involved with trainees. We're focusing on community outreach and research. We've partnered with the Y, where we've established a protocol for looking at obesity and pregnancy, and we're just getting rolling on that. That's one of my next 5-year goals, is to focus on community outreach and research in the clinical setting. In terms of other community service, we're establishing a residency training program in Ethiopia, which has one of the highest maternal mortality rates on the planet. We take this type of responsibility seriously. We owe something back to the whole world, not just Madison, Wisconsin. One of the greatest things about this department is the unfettered, immediate access to superior subspecialty care. This is where the academic center comes in. I'm going to start with reproductive endocrinology. When I was looking at this job, we had nothing. We had no building, we had no doctors, there was nothing. A big part of me coming here was a commitment from UW Health that they would focus on this and help me build the program, and I have not been disappointed. Between Donna and Jeff and the dean, the last 6 years has been unrelenting growth in this division. Dan Leibovitz came here from the University of Michigan. He has done a superior job and keeps cranking it. I just showed this picture because I like baby feet. I'm going to keep moving on though. Okay, we built the building. The building is out there and it is gorgeous and beautiful, intimate and private. You can imagine how it feels like you've got to go to someone to help get pregnant. This is intimate. This is couples. This is like, no, you don't want to walk in the front door of UWHC. This building is gorgeous, and the most important thing is not the building. Our success rates are much higher than the national average, and certainly higher than many organizations. That's all I'm going to say. If you look at this, you can see that in women under the age of 35, our success rates for the last 3 years, 50%, the national average is 47.6%. We continue to push forward with volume and quality. This is a little bit busy, but let me just say, we are so confident in our success rates that we transfer one egg only many times. Like if you just look at the women under age 35, the national average for transferring one egg is 11%. In other words, everybody's putting a lot of eggs in there, realizing that twins, triplets, there's a whole set of morbidities associated with that. And then this year we started a donor program for women and couples that don't have their own eggs. And that's a whole other program going on, but you can see our success rates are quite good. My day job is as a cancer surgeon for women. I'm chair of the department, but in this capacity I work for David Kushner, and he is outstanding. He's recruited outstanding faculty members. We're on the cutting edge of patient care, research, education. We're one of 42 fellowship training programs in the United States. I am proud to work for him. In terms of benign gynecology, again, UW Health brings it on. We are going to develop a women's pelvic wellness center. The two individuals on that side, Dr. Giles, Dr. Brown, have recently been recruited to work on fecal incontinence, urinary incontinence, pelvic support, and it will be a center of excellence, and we're partnering with urology on that. One thing I want to mention, going back to the reproductive endocrinology group, we are one of 3 programs in the United States that has a male infertility doctor on site working with our group. One of 3 in the U.S. Couples come, we can help the couple. So Donna mentioned those very sick babies with the very tiny hearts that need surgery. We take care of those babies while they are in the uterus. Dinesh Shaw has built a fabulous division, cutting edge care, huge outreach program, to get the baby to the point where they can have an operation. It's huge. And also when women, mothers, have complicated medical conditions, this is the go-to group. We're committed to research. We have a fabulous basic science group. We're in the top 15 in terms of NIH dollars. One of my big efforts in the next 5 years is going to build a translational research program, taking it from the bench to the clinic to the community, and that'll be a focus for me for the next 5 years. I love my peeps. More important than anything is that I've got really nice, smart, hardworking people in my department. Every morning I get up and I think I am the luckiest person in the world, and I believe it. And on a final note, I just want to say that none of this would be possible without the University of Wisconsin. I feel so happy that I made the decision to come here 6 years ago. It was a big move for my family, a big move for me, and I feel very fortunate.